For the first case, we have a 63-year-old male with a hepatitis B infection and who presented with 2 liver lesions in the right lobe of the liver. Upon presentation, the patient was noted to have an elevated alpha-fetoprotein of 5,400 and normal liver function with an albumin and bilirubin in the normal range. The CT scan showed a 1 centimeter lesion and a 5 centimeter lesion. And the patient underwent a resection, surgical resection of the 2 liver masses in February of 2014. The resection had negative margins, and the patient was then placed on surveillance until 2016, when he was noted to have recurrence in the liver as well as liver metastases. There are some unique features of this case, one of them being that this is a patient with hepatitis B, and patients with hepatitis B tend to be unique in the sense that they tend to have well-preserved liver function, and they can develop hepatocellular carcinoma without having had cirrhosis in the interim. So the patient had well-preserved liver function and no major evidence of portal hypertension, which allowed him to undergo resection. From there on, the patient had a recurrence and was treated with 2 subsequent lines of systemic therapy. And that's a relatively new development in this field, since for a long time we only had 1 line of systemic therapy, which is sorafenib, and now we have another one. So elevated AFP is certainly thought to be prognostic in hepatocellular carcinoma. So the higher the alpha-fetoprotein, usually the worse the survival, both the overall and progression-free survival. So I would say that is the main significance of the elevated alpha-fetoprotein. Elevated alpha-fetoprotein by itself is not a diagnostic criterion anymore. So to make the diagnosis of hepatocellular carcinoma, we either rely on histologic confirmation, as was the case here, a patient had a biopsy, or on the standard radiologic criteria, which briefly include the presence of at least a 1 centimeter lesion that has arterial enhancement in the arterial phase and corresponding venous or delayed phase washout on a multi-phase imaging study, like a CT scan or MRI. And of course, that has to happen in the right clinical setting of viral hepatitis or known cirrhosis.